Hi, my name is Iralis Castillo, and tonight we will be talking about the COVID-19 pandemic and specifically what we've learned as a society by going through this pandemic. We are going through confusing and terrifying times. We have new and conflicting information sometimes about COVID-19. In the early days, public health advice was based on what we've learned from previous disease outbreaks, but coronavirus behaves in new and unexpected ways. Here are a few of the most important things we have learned according to Scientific American and why we didn't appreciate them or understand them fully in the beginning of the pandemic. The first one is that outbreaks can happen anywhere. In the first few months, there was a lot of wishful thinking and othering, as in, oh, it's their problem, not mine. For example, Chinese people got it because of where they buy their groceries, or Italian people got it because of how they greet each other with a kiss on the cheek, or people on cruise ship got it because they eat from a buffet. But now we know that it can happen in urban areas like New York, for example, where they were, according to NBC New York, seeing an average of 660 people test positive daily. It can happen in rural areas as well. According to Healthline.com, rural population faces a higher risk of death from COVID-19 since 20% of their population is 65 and older compared to 15% in urban areas. But that's not the biggest threat this community of rural people face, is actually that they are not taking the pandemic seriously, therefore they're not taking the necessary precautions to stay safe from the virus. The next thing we have learned is that COVID-19 can unfortunately sicken and kill anyone. The first few victims of the pandemic were older or had pre-existing health conditions. And even though age and fragility are still risk factors for serious disease and death, now we know that COVID-19 can kill adults, teenagers, and children. For example, according to the Washington Post, young and middle-aged adults that didn't even know they were infected were dying from strokes related to COVID-19. This is the biggest threat we face for stopping COVID-19, and it's that many infectious people are infectious without being sick. Many apparently healthy people spread the disease without even showing symptoms or knowing that they're sick. They're spreading them by talking or breathing, and also by, according to medicalexpress.com, a study was made in Singapore that showed that 10% of new infections spread by people that don't even have any symptoms yet. So that is a big threat we face. In conclusion, we have learned a lot by going through this pandemic as a society, but this pandemic is not over, unfortunately. According to New York Times, the death toll is now at 993,600 people globally. So we need to continue to listen to the CDC guidelines, wash our hands often, use at least 60% alcohol hand sanitizer, avoid close contacts, always stay 6 feet apart, cover your nose and mouth with a mask, and clean and disinfect any surface that you touch daily. Monitor your health daily. This means being alert for symptoms which include cough, sore throat, shortness of breath, and fever. If you do have any of the symptoms, take your temperature and stay home. It's time to stop thinking based on myths and stereotypes and work together to stop the spread and put an end to this pandemic. Stay safe and healthy, everybody. Thank you.